Today we are going to be talking about mobilizing patients, how to do it safely while you're here at the hospital, as well as how to keep yourself safe. At Emerson, we have what's called a culture of mobility, and what that means is that it's really important to keep our patients up and moving as long as they're physically and medically able to do so. We have the saying that if they walk in, they should be able to walk out. And what that means is that it's our job to make sure that if they're medically able to do so, we get them up in chairs for meals, we walk them to the bathroom, we walk them in the hallway so that they can maintain their strength and endurance while they're here so that then they can go home. One thing that we need to think about when we're mobilizing patients is our own body mechanics and our own movements. We're responsible for keeping them safe, and we're also responsible for keeping ourselves safe. Healthcare workers, one of their primary issues with injury on the job is a back injury. So you want to make sure that when you're getting ready to lift or move a patient that you are standing up nice and straight, your abs are in, your ribs are down, your back is nice and straight. When you go to lift, you're facing the object that you're going to lift. You have a wide base of support, and then you bend down and you lift with your legs. If you need to turn while you're lifting, you're going to take steps so that you're going to avoid a lot of twisting because that will add some more stress to your back. So those are the basics of body mechanics. I have Melissa here. She's going to be our patient for the day. And we're going to run through typical ways and problems that you might run into when you're moving a patient so that you can help to sort of see how you're going to be doing it while you're up on the floors. Best practice, best advice I can give you is that if you're feeling unsafe, if you're feeling like this might be more than you can handle, ask for help. Never do anything that you feel is not going to be within your control. It's our job to keep the patient safe as well as our job to keep ourselves safe. So always, always, always grab a second set of hands if you feel like you need it. So the first thing I'm going to talk about is just moving in bed. So I walk in and here's Melissa. She needs to roll in bed. Ideally what I'm going to do is I'm going to lift the bed up to my height so that I don't have to bend over to help her to roll. How are you doing today?
I'm doing okay, thanks.
Good. I'm going to have you roll over in bed. I'm just going to lift the bed up a little bit. And then can I put you down flat?
Sure.
Okay. So if I'm going to have Melissa roll to me, there's a couple of things to think about. I don't want to just reach over and grab her and roll her. I want her to be able to do as much as she can on her own. So Melissa, I'm going to have you roll over towards me.
Okay.
Okay. Can you reach your arm across and reach for this armrest?
Okay.
If I have her bend this knee up, it's going to give her leverage to push. And now you can roll right over, look over towards me and roll onto your side.
Okay.
That's the ideal way. If she's having a hard time with that, if she can't lift her leg or if she can't move her arm, I can help her to bring her arm across because that starts with the movement. And then I can even grab onto the chucks and help her to come over. And you can see how I am keeping my back nice and straight and using my legs to help rather than grabbing with my back. Okay? If Melissa were going to come and sit up, there's a couple of different ways that I can do it. Obviously the bed needs to be down close to the floor now for her to sit. And we can go right from that lying or the rolling position to have her come and sit up. So Melissa, I'm going to have you bend your knee up. I'm going to have you reach your arm across. You're going to come roll onto your side. And now what I want you to do are kick your legs off the bed. I'm going to reach under Melissa's neck to grab onto her shoulder. And then I'm going to hold on to her pelvis right here. So when she kicks up off the bed, it's nice and easy to come up. I can do the majority of that work, almost maximal assistance, with very little work from my part. If she can help me to lift, it's always beneficial, but it's a pretty easy way to get somebody out of bed just by using the physics of getting them up. Okay? When she lies down, she can just do the exact opposite. So I'm going to have you lie down onto your side while you lift up your legs, and in you go. Again, I did the majority of that, very little stress on my body. The other way that you can practice supine to sit is if the patient's head is already up, you want to make sure their knees are flat. so that they're not kind of climbing over a hill to get out. And they can just sort of do a pivot to come out. So Melissa, I'm just gonna have you bring your legs over and come sit up on the edge of the bed.
Okay.
Okay? There you go. I like to grab behind here because it gives me a nice grip to be able to hold on to Melissa while leaving her arms free so that she can still use her arms to help. Lots of times patients will try to grab onto you. I'm just gonna have you lay down again.
Okay.
And they will try to grab you, help me up, right? And so I'm doing this, but I'm not really getting anywhere, and I'm just stressing her arm. Whereas if I say, I want you to push and use your arms, and I'm gonna help with your legs, let's come up together, I have really good control of her body. So it's a nicer, easier, safer way to do that. When she's sitting up here, I'm gonna take a quick little look at her balance. If somebody can't sit, they can't walk. So if Melissa is here and she's falling over and I'm needing to hold her up, walking to the bathroom isn't going to be our goal. Getting onto the commode probably isn't going to work either. Or I'm going to ask one of my pals to help me and see if we can see where we can go. But once she's sitting here, if her sitting balance looks okay, a quick and easy way to check to see if a patient is going to be able to stand is have them kick their leg out straight. Kick it up. Good. Relax. And now this one. You know she's got enough strength in her quads to be able to stand. Quick and dirty. Using a walker or having a walker close by is always a great idea. Lots of our patients come in and they don't use devices. They might say they use a cane, they might use a walker. If they're sick, deconditioned, a little bit weaker than normal, it's always nice to have something for them to be able to hang on to give them that extra support. Sometimes they don't need it, and you sort of, as you get more experience, you'll be able to tell that. But in the beginning, it's always nice to have that around. So Melissa, I'm going to have you scoop forward and put your feet down on the floor. Good.
Okay.
All right, so she did that beautifully. If a patient can't do that very well, scooch back. What you can do is help them a little bit with the chucks that's underneath them. So what I'm going to have, you relax.
Okay.
I'm going to have her lean towards the side, and then I can scooch her butt forward. And then I'm going to have her lean towards the side, and then I'm going to scooch her butt forward. I did all of that. But again, very easy, and you can see how I'm keeping my back nice and straight and really using my legs and my butt muscles to do it. So now your feet are on the floor, okay? And I'm just going to have you stand up. Push right from the bed, and come on and stand up. Beautiful. I like to hold patients sort of on their shoulder and on their pelvis area. We also have gait belts on the floor, which if you are a new practitioner, I would absolutely recommend that you use a gait belt. It gives you something really solid to hang on to. And ideally you would put this on before they stand up. But here they are, nice and tight around her waist. It just gives me a little something to hang on to so that if Melissa starts to lose her balance, I've got her. You really want to avoid pulling on the arms, pulling on the shoulder. I don't know if you can see, but because she needs her arms to be able to help her to push down on the walker. And if I'm pulling on it, she's not going to be able to use it as well. So here I've got a hold of the gait belt and I've got a hold of her shoulder, and then I can really help her to stabilize. If she starts to feel dizzy, if she's wobbly, if she looks like she's not going to be able to stand up, if her knees start buckling, she can sit right back down on the bed. Sit down. There you go. Okay? So she's safe right there. So this is our little test to see, can you stand? All right. So I'm going to have you put your hands on the bed and stand up again. Thank you. And once she's standing here, how are you feeling?
Feel okay.
Good. Any weakness or any dizziness? Your legs feel like they're holding you up?
Yeah, I feel good.
Good. So I want you to just take a couple of little marches there.
Okay.
So this is another little quick test you can do to see if they can lift their feet, if they look like they're wobbly, if they're not holding their legs up, if they start to fall. Walking is not going to happen today. She looks pretty sturdy and good. So what I'm going to have you do is just come and sit right here in this chair.
Okay.
And again, I'm going to stay nice and close. You're just going to take little steps back right up to the chair until you feel it behind your legs.
Okay.
And then you're going to reach back for the armrests and sit right down. Oh, you're so great. There she is. Okay? So there's your first transfer. Walking, ideally a patient's going to be able to walk into the bathroom or walk in the hallway. Come on and stand up again, Melissa. And what you're going to do is you're just going to push this like you push a shopping cart.
Okay.
And we're just going to walk out into the hallway. You're so great. And I've got her here with this gait belt. So if she starts to lose her balance, then I can help her. And again, I'm going to hold on to the gait belt, and I'm going to hold on to her shoulder. I'm not going to pull her arm up because she needs that for her balance. But I have her here to be able to stabilize her. Come on and turn around and go sit back down. Beautiful. So I'm always close. You're going to back right up, reach back, yep, and sit down. I'm always there so that I can help her, but I'm really letting her do as much as she can on her own. The other thing to think about is when you go in to see a patient for the first time, that you want to be able to set up the room so that it's going to be successful, however you are going to be able to mobilize them. So you have a chair right next to the bed. The chair has an alarm on it if the patient's a fall risk. You have a walker if you need it. If you might even want to bring a commode in if you think perhaps the patient isn't going to be able to walk to the bathroom. You have a commode there if they sit up and really need to go to the bathroom but aren't going to be able to walk into the bathroom. The other thing I wanted to talk about is a squat pivot transfer. If a patient is unable to stand or unable to walk, we can still help them in and out of bed doing a transfer where they just kind of squat, turn their bum, and sit down. So not a lot of work through the legs. And I'll show you how to do that with Melissa back into bed. So I'm going to put the bed down. I'm going to move this armrest out of the way. I'm going to get the chucks ready so that when I help her, it's going to be right underneath her bum in case she needs any more assistance to scooch up in bed. And there's a couple of different ways to do it. Ideally, you want the chair to be as close to the bed as possible so that there's a least amount of space that her butt has to traverse before she gets over there. What I'm going to do is I'm going to come right in front of Melissa, and I'm going to put my foot right in between her feet, and I'm going to bend right down. Melissa, I'm going to put my arms right around you and hold on to that belt.
Okay.
And what we're going to do is I'm going to have you lift your bottom and put it right here.
Okay.
Okay? So I'm going to come right around you, and we're going to lean forward. We're going to count to 3, and then we're going to lift and move on to the bed. Okay? You ready?
Yep.
1, 2, 3. Lift, turn, sit. Okay? So that's one way to do it. The other way to do it, I'm going to have you come sit back down here.
Okay.
This is a little trick of the trade. You can use the bottom armrest there and do the same thing, but now Melissa has something to hold on to, so she's going to feel more secure. So as long as she has good control of that right arm, that left arm, Melissa, I'm going to have you reach for that armrest.
Okay.
And then we're going to stand up or scooch up a little bit and put your butt right over here.
Okay.
Okay? You ready?
Mm-hmm.
I'm going to count to 3 and then we're going to go.
Okay.
1, 2, 3. Beautiful. Now that you're sitting there, I'm going to have you lay back down.
Okay.
Okay? So you see how she scooted her butt back there? Ideally, if you can get the patient up high enough in bed and their butt scooted back, when you lay them down, you're not going to need to boost them up, which decreases, again, the stress on us as far as moving patients. So the higher you can get them and the further back you can get their butt, the better off everybody is. And so now I'm just going to have you lay down.
Okay.
So you can lay right down, we'll lift your legs up, and down you get.
Okay.
Yay, you did a great job.
Thanks.
So that's sort of the very basics about moving patients. We are always here to help you. The best advice, like I've already said, that you can give, that I can give you, is to always, always, always ask for help. Some of these transfers, like that squat pivot, the first time you do it or the first few times you do it, you absolutely want someone with you. That can be a little bit intimidating, so please ask for help. We're here during the days as physical therapists. The nurses are here. The more that you can learn about mobilizing patients and the more you do it, the more comfortable you'll become with it.